Hi, my name is Dr. Namita Pareek. I have been part of Gastroenterology Associates of Gainesville for almost 6 years. I was born and raised in India. I finished my medical school in India, did my training in internal medicine and gastroenterology in Jackson. We chose this area to raise our family because of our interest. We love to travel. I love a lot of different outdoors things such as mountain biking, mountain climbing, mountaineering, rock climbing, zip lining, hiking, you name it. My childhood dream was to be a black belt in one of the martial arts, and I'm still working on it. Not there yet, but working on it. The reason I chose gastroenterology as a profession is actually multifactorial, but to keep it simple, I wanted to talk to my patients. Sometimes I feel that being a counselor, a psychiatrist, prescription of medications, healing your patient, that is something that I'm passionate about. So as Benjamin Franklin once said, an ounce of prevention is more than a pound of cure. It applies to colon cancer. Colon cancer is one of the most common cancers in our country. It arises from a small growth called polyp. And if we can remove these polyps before these polyps turn into cancer, we can save a lot of lives. Colon cancer alone kills as many people as all other cancers combined. So it is common, deadly cancer. If there is anything that we can do to prevent it, it's worth it. Based on the statistics, 1 in 17 individuals will develop some type of colorectal neoplasia. After having a colonoscopy, your risk of having any of these neoplasias goes down to 1 to 1,000, so significant risk reduction. Colonoscopy is safe, effective, and quick in prevention of colon cancer in trained hands. So, who should get a colonoscopy? All individuals over the age of 50 should get a screening colonoscopy. All African Americans over the age of 45 should get a colonoscopy. If you have a family history of colon cancer, your colonoscopy should be done at age 40. There are certain other high-risk groups that do need a colonoscopy sooner than that. Who should do your colonoscopy? Just like you would not let your car in hands of a 16-year-old or a younger teenager, similarly, you want your colon to be in hands of trained people. Gastroenterologists spend 3 years of their life to get trained in endoscopic procedures. We are specialists in colonoscopy and prevention of colon cancer. Variety of studies have shown that polyp detection rate and colon cancer prevention rates is much higher in group of patients who had colonoscopies done by gastroenterologists versus other group of physicians such as primary care, general surgeons, or mid-level providers. Keep that in mind. Another thing that I want my audience to be aware of is a polyp detection rate. You can imagine, so nationally, about 15% of females and 25% of males who are undergoing screening colonoscopy should have polyps. Our group, I'm so proud to say that, our group has polyp detection rate 3 times higher than that average, national average. About 50 to 60% patients get diagnosed with polyps. Why is that? Because we are paying attention to your colon. If you have a polyp, we will try to find it so that we can protect you from having colon cancer. When you see your physician who is doing a colonoscopy, make sure to ask, what's your adenoma detection rate? Or in other words, how many polyps do you, on an average, you find? Higher your adenoma detection rate is, more likely your physician will be to prevent colon cancer for you. What can you do to prevent colon cancer? Well, as I said, colonoscopy is number 1. Most common risk for colon cancer is age and genes, which are unfortunately unmodifiable. Healthy dietary habits such as fresh fruits, fresh vegetables, lack or minimal animal fat and protein is helpful. Keeping body weight within normal range has been shown to be beneficial. Adequate vitamin D, low dose of aspirin has also been shown to be beneficial.